This is a really active area of research and could be due to many different factors linked with some of these statistics that we see for early onset breast cancer. Some of the factors could be biologic reasons for why these cancers could be more aggressive, as well as genetic factors that could be driving the development of these more aggressive cancers. I think one of the biggest factors is screening impacting the more aggressive nature of these cancers, or perhaps more late-stage identification of these cancers. We know that it's really important to adhere to breast cancer screening guidelines in the population to catch these cancers when they're early and curable and treatable. And what we noticed in the COVID-19 pandemic is that screening rates were not able to be adhered to because of the pandemic going on. And so one of the biggest things to keep in mind is have the screening done at the right time. And some of the factors that influence that could be knowledge of family history. So breast cancer screening might need to start at a younger age if there's a family history of breast cancer. And therefore, if screening isn't started at the right time, these cancers that are detected could be detected at a later stage and could be more aggressive. I think it really points to the need to emphasize public awareness about the need for breast cancer screening and knowledge of family history, and then more research that is needed to get some insights about the aggressiveness of these cancers. There can be multiple factors that are barriers to engaging in care for patients with early onset cancers. Some of these barriers could be barriers that pose challenges to accessing the healthcare system. So for example, having adequate insurance, having financial resources in place. As we know, healthcare can be expensive, and so being able to have financial resources to help pay for a patient's healthcare. And there can be lots of other barriers too, for example, transportation. So how does a patient get to a healthcare center to have their treatments or their surgeries and things like that? How do we support patients who have childcare needs or who are taking care of elderly parents or adults, in their lives? These are individuals that have a lot of responsibilities that they're dealing with, and so many of these can pose challenges to engaging in healthcare. Other things that can pose barriers are really just knowledge about early onset cancers. So knowing what are the risk factors for early onset cancers, for example, family history, what is the age to begin screening, etc. These are really important sort of community barriers or public knowledge barriers that we do need to address. And then a third sort of major category of barriers would really be to think about diverse, minority, underserved populations. Here, oftentimes there's language barriers, cultural barriers that really need to be addressed and related to so that we can help patients think about their care, think about the development of early onset cancers, and really have the appropriate care that they would need. This is a really important thing to think about regarding patients with early onset cancers, and the reason why we're developing an entire program addressing these patients. Really, there can be support that's needed from a psychosocial standpoint, from a physical functioning standpoint, and also from a mental health standpoint. So really, we've noted, of course, that these individuals who have early onset cancers, and again, that can be defined as ages 18 to 49, are really individuals who have multiple responsibilities in their lives. Oftentimes they are employed, they are parents, they're taking care of children, they're also caregivers for elderly parents or other members of their family. All of these things really can pose a significant level of kind of add overwhelm to a person's own feeling that they have a cancer diagnosis and they have these responsibilities on their plates. There's also some unique challenges to talk about or help patients walk through some scenarios that can impact them in terms of their quality of life. So for example, fertility issues that can be, that need to be discussed with these patients in terms of maintaining or preserving fertility, which can be impacted by certain treatments or surgeries. Sexuality can be impacted as well. And as well as social functioning. So oftentimes these individuals may feel very isolated from their peers, from their communities, and have an impact on their self-esteem. And so all of these really can have an interplay on how the patient is having their experience with not only a cancer diagnosis, but in their life, even in terms of maintaining employment. So having breaks from their job to go get treatments or recover from surgery could be very stressful to think about. So there's the psychosocial needs that have to be addressed for these patients. Physically, of course, recovery from, say, from a surgery is really, can be very challenging. And again, these are very busy individuals, so recovery from a surgery plus jumping back into life can be very challenging. Long-term toxicity from chemotherapies or other treatments, radiation, could be something that these patients grapple with as well, and so we know that they need support physically. And these things can entail physical therapy, occupational therapy, et cetera, other ways to think about really getting back to full functioning from a physical standpoint. Certainly from the mental health standpoint, we know that this can be very challenging. These individuals are dealing with a new cancer diagnosis at a young age, and it can be very tough to cope with a cancer diagnosis at any age, let alone at a younger age. But also there can be underlying depression and anxiety that could be exacerbated by a cancer diagnosis, in addition to all of the responsibilities. So we have to keep an eye on mental health as well for these patients. So we really want to think about supporting patients from a holistic standpoint as they're going through their cancer care. So this is a really important priority to think about for our new program in early onset cancers. And one of the things to keep in mind is that having a cancer diagnosis in the first place is a big deal. It is really hard for an individual to hear that they have a cancer diagnosis and what this means for them and their life. And so we really want to make sure that we're addressing the needs of patients with cancer from the clinical aspect in terms of the treatment of their cancer, opportunities for clinical research to advance our understanding of really improving cancer outcomes, as well as having research that addresses the population-specific needs for individuals and what they might be dealing with for challenges. One of the biggest things to keep in mind is that these individuals with early onset cancers, while they're dealing with a cancer diagnosis, are dealing with many psychosocial issues as well. And these issues can really impact how they engage in their cancer care, their quality of life as they're going through cancer treatments, and into survivorship as well. And so one of the first parts of our program that we're launching is a navigator program. And we are hiring and training a navigator specifically for patients with early onset cancers. And this particular navigator is going to be addressing what are the needs that a patient has who has had this recent diagnosis of a cancer, and what will they need to be able to engage in their care and go forward into survivorship. These can be different for every patient. So for example, some of the needs that patients can have can include a need for insurance or financial stability to go through their cancer treatment. Other things could be transportation and food insecurity. So these are very important to address for patients with cancer. How are they taking care of their children or elderly individuals in their family? Other very important things to keep in mind as a person is going through their cancer treatment. Fertility issues and sexuality, medicine are very important to bring into the picture for these individuals who are young. And so these can be very important barriers or concerns that a person has as they're going through their cancer treatment. So we really want to ensure that we're addressing the full spectrum of the needs that a person has as they're going through their cancer care and into survivorship. And we really hope that the Navigator program, we're very excited about the Navigator program as a way to have a true partner for a patient with cancer as they go through their cancer journey. There are many ways that we want to bring more awareness about early onset breast cancer to young women. And we're doing this in lots of different ways here at Yale and also in the community. So through Yale Cancer Center and Smilow Cancer Hospital, we're leveraging many of the robust mechanisms that are in place already for how information is sent out into the community and into the public. So for example, Smilow Shares is one of the programs that Smilow Cancer Hospital has as a way to give information about cancer, cancer risk, treatment, and raise public awareness about issues surrounding cancer. And these have been very well attended, and we're very excited to use Smilow Shares as a way to talk about early onset cancers now and for women to think about younger onset of breast cancer. We're also partnering with parts of our program, such as the Community Outreach and Engagement program, which is really dedicated to having links between Yale Cancer Center and the community, particularly diverse populations, to think about what it means to have knowledge and awareness about cancer risk and what to do about that risk. So how do we engage in screening? What does that mean to know about family history? And early onset cancers is going to be one of the priority areas that we will focus on, partnering with the Community Outreach and Engagement team to be able to spread this information to more diverse populations and underserved populations as well. A third way is really partnering with advocacy organizations. So organizations like Bakes for Breast Cancer are really critical to be able to spread awareness and information and knowledge about early onset cancers, early onset breast cancer to the community. And we also will partner with multiple advocacy organizations in the state of Connecticut and also nationally to be able to spread the word about knowledge and awareness about early onset breast cancer and early onset cancers in general. And furthermore, really having the patient stakeholders involved in this awareness effort is really important, as they really are the ones who are experiencing this whole field, and particularly here for early onset cancers. So we are working with our Patient and Family Advisory Council here at Yale to really get their perspectives about how to raise community awareness, really building out support groups across the state of Connecticut to be able to address the needs of patients with early onset cancers, and really make sure that we're addressing the key individual, which is the patient themselves and their families who are dealing with early onset cancers.